Hello, I'm Dr. Padmaja at Medcy Hospital, Vijayawada. Today we are talking about one of the most common hormonal problems that women face, and that is polycystic ovary. Essentially, every woman has a uterus with a lining which is shed every month in a menstrual cycle if there is no pregnancy. For this lining of endometrium to grow, in the ovaries there are follicles. Usually, if we consider this as a menstrual cycle, one of the small follicles that are picked up every month, one of them will grow in size and release a hormone called estrogen when there is a maturing oocyte inside the follicle. Estrogen leads to a growth of the endometrial lining, and when there is a good follicle, it will ovulate and release the oocyte. This is called a corpus luteum. Follicle growing is releasing estrogen. Corpus luteum will send progesterone along with estrogen. This makes the lining ready for a baby, and if this oocyte resulted in a pregnancy, the baby is going to grow here. If there is no pregnancy, corpus luteum life is 10 days, it is going to shut down and the hormones are going to fall and a period is going to come. This is the normal way the reproductive system is supposed to work. But what we are seeing nowadays is that people are having the entire system in place, but there is an abnormality in these communications that is leading to many small follicles being there, not one of them going ahead for ovulation. So follicles are continuously getting recruited and staying at this level. That is leading to irregular fluctuating estrogen level. So the endometrial lining inside the uterine cavity is growing irregularly. When there is no progesterone, continuous irregular estrogen leads to a irregular endometrium which breaks through and bleeds on and off. So what is being seen outside is irregular period, but what is happening inside is that multiple small follicles are getting arrested without doing the job they are supposed to do in the ovary. So the ovary looks big with small follicles. That is, poly means many. Anything with fluid is called a cyst, and because these are there in the ovary, the popular misnomer is ovary is full of water bubbles. But these are not water bubbles, these are simply follicles that got arrested without developing. What are the consequences of this? Estrogen is a hormone that causes a growth. Progesterone is a hormone that calms it down. So if there is no progesterone and only estrogen, unlimited growth leads to heavy bleeding. The most common manifestation is periods are late, periods are heavy. Sometimes periods don't come without medications, and when they come with medications, they don't stop without medications. This is going to lead to a very big disruption in the menstrual cycles, loss of blood, anemia. And sometimes this leads to growth of the endometrium to form small polyps. Sometimes if there is a mutation in the muscle wall, it leads to formation of fibroids. High estrogen level with the endometrium being shed this side and sometimes getting into the peritoneal cavity through the tube leads to sticky layers in the ovary and the tube, leading to increased endometriosis. And without ovulation, without the oocyte coming out, there can be no pregnancy. So the consequences we see is in young people, irregular periods. Not only that, in the ovary, the tissue that is around here is making the male hormone. The follicles that are growing are converting this male hormone into the female hormone. When the follicles don't grow, the percentage of male hormone increases, and that male hormone circulating in the body will show its effect predominantly on the skin and hair. So people lose hair and become bald like the men, or they have unwanted hair in the form of hair on the upper lip and chin. The skin sebaceous glands are very sensitive, so they can be very severe pimples and acne. So the male hormone manifestations come this way. And male hormone, when it increases, it leads to increase in the insulin. And when insulin hormone increases, that can lead to a resistance to insulin, and that is a pre-diabetic state. And people who are thin and shapely like this start putting on weight, and metabolically active fat gets deposited and they put on, that weight is very difficult to lose. So depending upon how severe the manifestations are, we can see. So some people have more pimples, unwanted hair, some people have highly irregular periods, some people have obesity, and all these have long-term consequences by increasing the incidence of diabetes, hypertension, coronary artery disease, breast cancer, uterine cancer in women in their later age life. And can we do nothing about it? Of course we can do. There are good management protocols. Most important thing is having a diet which is balanced. There should be limited amount of carbohydrates, and in our diet whatever carbohydrates we are getting should not be easily available digestible carbohydrates. So they should be a high fiber diet, high protein diet, extremely low salt, no added sugar, no soft drinks, very limited salt. And whatever diet we take, we should be able to exercise to burn the diet that we are taking. So there is no program of PCOS that is complete without an exercise program. The simplest exercise program is 10,000 steps a day. If you cannot do it, compress your physical activity, do some walking, do some jogging, do some skipping, do some aerobics, take up a dance program, walk up the stairs. So inculcate activity in your daily life. It is not absolutely necessary that you go to a gym, have a trainer and do an expensive program. Whatever is in the limit, and any form of exercise is good, and yoga is one of the most complete comprehensive exercises. So that nowadays there are so many available even on the net. Pick up a program that you enjoy and you can consistently do, and that should work out very well. Along with this, because the hormones are going haywire, you might need hormonal treatment, and based on your requirements, if you need treatment for your abnormal uterine bleeding, treat that. If you are treating hyperandrogenism, treat that. If you are having a fertility issue, go to an expert. And even after having, even in pregnancy in PCO women, they have a higher risk of miscarriage, higher risk of having high blood pressure in pregnancy. In pregnancy, diabetes can be there. So taking a healthy diet is important, and the baby is being programmed inside the mother's tummy. So if the mother is unhealthy, the same unhealthy programs the child is going to inherit. So make sure that in pregnancy also you are active, take care of the diet, make sure that you are exercising well. Unless there is a pressing indication, there is absolutely no role of complete bed rest in pregnancy. Once women deliver, they need to lose all the weight that they put on in pregnancy. Once they deliver, the babies need to be exclusively breastfed, because that is the best program and best gift a mother can give the baby. And follow the contraceptive needs, have annual checkups, get your hemoglobin done, get your weight and BMI checked, get your cholesterols done, get your blood sugars done. So these health care will make sure that even if they have PCO, your quality of life is not going to be worse than anyone else. Only thing is, remember that because the programming is different, the metabolism is different, learn to accept your body nature. So you can't envy someone who is reed thin in spite of eating much. You're going to put on weight, so you have to be careful all through life. And one more thing is, our hormones change the way we feel, we express thoughts. So anxiety and depression are also more prone in women with PCO. So make sure you have a good social circle, a good support system that will prevent these from happening. So I hope women with PCO who are going to be almost 10 to 20% of the population learn and make changes so that they don't suffer the consequences. Thank you. This is Dr. Padmaja at Medcyivf.